I was like pulling in late. There's people that have been there for at least an hour.
I never lost spot by the
Yeah.
door.
All right, we have time.
Oh, I couldn't.
Okay.
No, I had.
What are we missing?
It's when I went over to, they had a shot in it.
Already.
When I had it.
Sure that's.
I said, I don't know. I didn't know. But I'm going to speak her next to it. When you start.
The Community and Health Services Standing Committee to order. Have a roll call, Miranda, please.
Miller. Here. Brewer. Kramer.
Here.
Maybe it looks like ceremony.
Can you hear us, Sandy?
I can, yes.
Okay, you're just muted.
No, she's not.
Oh, she's not.
You had problems with.
Is it, so it's on our end, not your
I
end?
think so. When with the last meeting, but I said Mr. Brookins.
So Sandy, it sounds like we're having technical difficulties. We can't hear you even though you're not muted. Working on it. Please chat something. If we don't figure it out, put it in the chat box so we can at least see if you have a question. Okay.
Okay, Harwick,
Here.
Glassburner,
Here.
McGuire,
Here.
Barris, Braithwaite,
Here.
Checker. You have 6 rooms for ma'am.
Okay. And verification of posting?
Yes.
Yes. Okay. I will need a motion then for approval of our 13-point agenda. Thank you, Mary. Second by Dan. All those in favor, please say aye. Any opposed? Miranda, not to make this more difficult for you, but since we can't hear Sandy, is there a way to have her video up so we can at least?
I am trying to figure out what I did. I accidentally clicked on something and there we are.
Oh, there it is. Okay.
I'm not a techie person.
I know, and so I'm sorry. Candace, we're having trouble. She's not muted, but we can't hear her. So, and Miranda says it's on our end. I don't know.
It happened last meeting with, because Bob Brookins and I went back and listened to the recording and he could hear us, we just couldn't hear him. And she's unmuted.
Okay, I'm gonna keep going. Approval of minutes from the August 1st meeting. Does anybody have any changes or corrections to make? If not, then thank you, Sandy. If not, then I'll declare those approved. Number 6, public comments. Do we have anyone from the public here or online that wishes to speak? Okay, we'll move on to reports. Number 7A. Trisha.
Okay, so in the package, you saw our September 2024 updates. Just some highlights that I want to point out. At the ADRC, they're offering a couple of groups. One is a powerful tools for caregivers that starts on Monday, and the other one is Boost Your Brain and Memory. So those are just groups that they host on a regular basis, but we'll be having those available this fall. Our public health unit is now fully staffed. Brandon Alexander transitioned from our crisis worker into the public health specialist. So Brandy is once again fully staffed, which is good for her. The other Brandy is not, but we'll get there. In our behavioral health, we did have our mental health therapist begin, and so she is on her 3rd week, spending lots of time, second week, spending lots of time getting trainings done, acclimated to Richland County, our system, so that's been very good. And we had our first successful drug court graduate. So we've had treatment court for a while. We've had many graduates from sobriety courts, but this was our first drug court graduate, so that is very exciting. In our child and youth services, we did hire a new worker, and she will be beginning on September 23rd. And we're very excited because she came from Juneau County and has county experience. She's been there quite a few years, and she's actually worked in Richland also in the past. So she's excited to be able to come back home. The other thing that I really wanted to highlight was on October 16th, our offices will be closed for the day. We are having an all-agency training day. I did have an agenda item cover in there with all the information, but we're going to have two presenters that day. One will be presenting on proactive safety, situational awareness, and de-escalation training. This is something that staff have talked about, is how do they keep themselves safe when we have volatile people in the office, when they're going on home visits. So we hope this will be very beneficial. And then the second presenter will talk about trauma-informed care, give us a good overview of it, and also talk with us about how do we take care of ourselves. So I'm very excited for that. Last year we did have a half a day. This year we are doing a full day of training. So I just wanted to let you know that. And then the last piece is our ARPA spending plan, and I can have Stephanie talk through that.
Sure. I had to pull up last time so I can see what was different. So this time you'll see, we've paid for some more of the expenses. We've paid for more of the items in the spending plan. We've paid the bill for the pharmaceutical grade refrigerator. We paid, they paid for the finance software. So I have to submit for reimbursement for that. We paid for our leadership.
It's like right after the minutes and the agenda item. Sorry. All of it was in my packet. I don't.
What am I looking for?
Yeah,
Sorry.
keep going. Right here.
Right there. Right, so then, we paid for the leadership training that we have through Southwest Tech that the Health and Human Services leadership team went to. We paid for the phone upgrade, which had been approved, by county board, got that paid for. And then just a couple of other small things. We paid for a translation subscription for document translation. It's an annual subscription, and then, some outreach, I don't know which documents, like brochures, things like that for handing out for communicable disease outreach that we took out of that pot of money. One thing sitting right now, it's not on here, but I got the invoice on it like a couple of days afterwards, is the network switches, which was also a big purchase that went through county board as well. So that'll show up as an expenditure next time. And that actually came in at less than the 48,000 as well. So that's where we're kind of at.
So these are funds that have to be spent by the end of the year, and I think it was Supervisor Miller that had asked that we keep bringing this back so that we're actually using the funds and not leaving anything on the table. So those are things that we'll continue to talk through, and many discussions with Candace in the future also about how do we make sure we're using all of it.
Thank you. HHS expenditures report. Vouchers and expenditures over 2,000.
I think the biggest things on here you'll see is where we did pay for the refrigerator, on there. This refrigerator, that's really big. Otherwise, I didn't know. I don't think anything else jumped out as really out of the ordinary. Candace has approved them. So.
Any questions, anyone? How much was the refrigerator again?
The refrigerator was that new line for 10,000.
Okay.
$896.
All right, then budget summary and placement report.
So the 2024 budget, we're pretty close on to balance or zero. I mean, we're a little bit ahead 9,000, but it's obviously, it's just a estimate is where we're kind of at. The biggest piece that I built into it is the anticipated revenue that we don't have in yet, so it could be missing some pieces in that. But expenses are would be obviously actual, so it's just the revenue part that I'm guessing that should be coming in, but there's no like revenue out there that I anticipate is gonna be, that we didn't budget for. We should be at about 58% utilization across all programs and units. We're about 55%. If I look at some of them that are a little bit higher, there's 2% higher for a couple of them, which is, I wouldn't say is anything to worry about.
Public health is higher
Public health.
because of all our spending that's going there.
So, those the refrigerator, the switches and all those things, those were not in the budget.
It's gonna lift into the budget part.
PCS, it looks like it's higher too.
Yeah, just enrollment's higher, services are higher, just we're paying for more services, so, but again, that's 100% reimbursed, so. Most services are 100% reimbursed. Otherwise, I think everything else is pretty under that.
I can't believe how low our adult placement is. Utilization, it says we're 34% utilized.
So,
Wait, why was that?
Yeah, I would just say we do have somebody that's currently at Winnebago, that may be there for a while, so.
Okay,
That's
that's gonna
fine.
go up then.
Yeah,
that was too, and also too for the adult placements, because this is getting, it's close, right? And if I go look at cash balance in Fund 56, I'm like, it's kind of starting to kind of decline a little bit. So this is the point where I will probably start, we have one high cost placement. They'll start taking some of those services and having them charged to Fund 54. Because because we're only at 34% utilization,
Fund 56,
The cash balance is good, it's good, don't get me wrong.
that's just our general
That's
operating?
our core budget.
core budget.
Yes.
And what did you say they would start charging to 54?
One of our placements,
Oh,
that we have issued, the individuals in CCS. So we'll start taking some of those services and charging them to the placement because there's no wiggle room in there right now, so. But the good news is we lasted almost 2 months longer than we did last year, so. Okay. Children's is right on, and I don't see that going down at all either. All high cost placements.
any questions for her on the budget? Well, then that'll take us, Sandy, you good?
I'm good.
Still can't hear you, but.
Do a thumbs up.
Okay, 2025 budget update. What has changed from
So had a conversation with Candace and Larry, and they wanted to see if we could make some changes. So I made some changes in that we took out the contracted mental health therapist. And so just put in a employee mental health therapist.
Didn't we just approve the contract?
Yes. Yeah.
yes.
So that was just for 2024 or,
We approved it and then we had somebody turn in an application and then hired internally.
oh,
So we actually have a county employee versus contract. So it'll save us about $150,000.
well, is that, are we utilizing the contractor at all this year?
We're very excited.
That's great.
So we had originally put it in the budget
Yeah.
for 2025 just to be ready for that. And
Okay.
so we were able to take that out. So that reduced it quite a bit. Still a little bit of increase in there with the, this was just some other direction that we were given as far as raises and insurance and those kinds of things. But this is kind of where it's at right now.
So the main change was just removing that.
That was the main change.
Okay.
Yes, yes. I can't remember. Is that off? I think that was it.
All right, questions on the 2025 budget? Okay, thank you guys, good work. Contract monitoring report, what % utilization should we be looking for? 58?
58%, yes.
Okay,
Should be at 58%. But as you can see, the current month invoiced, some are June. If they're June, then they should be at 50%. So I think the only driftless, we'll probably be bringing that. And again, driftless, that's because of all of the increase in services, right? Yeah.
Northwest
I
Wisconsin.
think if there was any others that I wanted to highlight. Some of them, one of them we just brought back already. You are enough counseling's a little bit high, so, and this report shared with all the managers, so they know where they're at and they can, if you'll see all the zeros, those are our CLTS providers. We're having trouble getting reports from the state almost, so it's been a battle since probably the first of the year to get access to those reports. So as soon as we get those in there, we're updating
So I
those.
didn't see any new contracts this month, but it looks like we do have quite a few that are over.
A couple, yeah.
So
that
those
we'll
will
have to
come.
bring forward, yeah. And then like Southwest Workforce, I'll bring that next month.
Okay.
Obviously, that's a little high.
Yeah, with driftless, we were kind of just sitting on it to see how they continued to trend and where we need to go with them. And then Northwest, we had hoped that they would maybe drop, but our numbers for our crisis calls after hours continue to go up.
Yeah. Let's just have the red vehicle counseling's a little high.
What is the most traditional living center?
That was a residential placement center for a youth, and he left, so we don't have anybody placed there. So we're doing okay with that. We won't have to redo that.
Anybody else see anything on there? Any questions you have? Now we'll look for those next month and move on to, so that would take care of number 8, because I don't think we have any contracts, correct?
Correct.
So number 9, the resolution approving the Department of Health and Human Services to apply for and accept a treatment alternatives and diversion grant. I was gonna tell you, you're welcome to just sit here, obviously. You can like move back and
Since the
forth.
beginning, I was always told this.
As long as there's space.
So it's just getting to be that time of the year again, where some of our annual grants are going to be up to be redone. So the first one is the TAD grant, that is our treatment court program. Our grant total is $173,333, with a county match of $43,303. This funds our alcohol and drug treatment court that's in the county. I think this is the last year at this amount, right, Stephanie? And then next,
This will be year 5, yeah.
then they reassess our value next year, so. Questions on that, the treatment court?
One of the things with the 43,333, that does not all have to be cash match. So as you'll note, we're estimating that about 28,000 will be cash match, the rest will be in kind. So the time that county employees contribute towards the treatment court can go to in kind. And so we're very good about maximizing that and really tracking that well, because that does lower the amount of cash match we have to give.
What did you just say? For the county employees?
So with the treatment courts, there are quite a few county employees that are a part of treatment court, either in supporting it, like Stephanie with helping complete the budget, do reporting. The judge is a part of treatment court.
Sheriff deputy.
Department, district attorney's office. So all of their time can be used to in-kind, towards in-kind. So they get paid by the county or by the state, and then what their hourly wage would be, we can say to the treatment court, when we report it to the state, that this is the time that they gave to the program, and that knocks off the amount of cash match we have to have.
Oh, okay. You can think of cash match as tax levy.
Yeah.
So, thank you.
So what does it look like when they reassess? What are you anticipating?
They just look at like where our like numbers have been tracking, like what our spending has been like. Now that we have 2 programs, Are we spending more in supplies? Are they gonna need to give us more? Have we been sending a bunch back consistently every year? And I just kind of look and see where we'll fall for the,
So it's not a question of like whether or not we'll continue to get the grant, it's just how much.
yeah,
Okay,
how much they'll get.
okay, thank you.
I have a question. When you get a grant, do you all write for these grants or is there someone in the office that takes care of that?
For the most part, the manager takes the lead on that. So for treatment core, Brandy takes the lead on writing those grants. If it's a grant for children's, then Kayla would take the lead. So between the six of them, or five, because Stephanie usually doesn't have to, they take turns taking the lead and writing them, the ones that are relevant for them. And then I'm in consultation with them. And then when there is a cash match, we have to bring it to this committee and full county board to get the approval so that we're not spending the county money without
Thank you.
somebody finds. Yeah.
Good questions. Any other questions or comments? All right, if not, I'll take a motion to approve this item. Francis and Michelle. Did you get that, Miranda?
Francis and then Dan.
No, Michelle Harwick. Thank you. All right, all those in favor, please say aye. Aye. Any opposed? Okay, number 10, resolution approving the Department of Health and Human Services to apply and accept a 2025 Coordinated Services Team Initiative or CST grant. A quick question. Did IT manage to get that fixed or no? No. Sorry, Sandy. Okay.
So our CST grant is another one that we apply for every year. We are taking less this year, than what we normally do, just because we haven't seen as much enrollment into that program. So we're gonna go into a $15,000 contract, and that's $30,000 of cash match.
3,000.
3,000, sorry, that was a, whoops. $3,000 of cash, match from the county. And CST is really a wraparound service for youth, that are involved in multi levels of care. And then they have the CST workers kind of coordinate services for within that family.
So this is one that we were going to not renew the grant. And the state came back to us and said, if you don't take it, it's really difficult to get back. And so for the long term, I didn't want to, whoever replaces me in the future, I didn't want them to have to start from scratch. So we're gonna try to do it at that lower amount, provide the service. It's really looking at providing the services that we are, not what we could, because we just couldn't get this program built.
Just a quick comment. I think it was on the original document because both of these agenda item covers, it's where it says the grant does require matching funds. It says in King match instead of.
Okay.
Yeah. Okay, if there's no other questions. Can I have a motion to approve this agenda item?
I make that motion.
Thank you. Do I have a second?
Second.
Francis? All right, any further discussion? All right, all those in favor, please say aye. Any opposed? Okay, moving right along today. Any correspondence? Great. Future agenda items. Does anyone have any future agenda items they wish to see put on? Any thoughts from you?
Not that I can think of right off. Well, next month we will have our aging plan. We'll be bringing that to this group to approve, and then we'll go to the full county board to approve an aging plan. So that's something that our aging unit through the ADRC has to do, and we have to do a 3-year aging plan. So it would be for 26, 27, and 28, and talk about what kind of services and goals that we have for those funds that we receive.
Okay.
So federal.
The only other thing I see on here is we'll be up for review of the org chart.
Oh, yeah, let's do that. Okay, that next month too. Okay, Sandy, are you good, or do you have any questions or agenda items?
I'm good.
Good, okay. Thanks for being patient with us. All right, well, that takes us to adjournment. That'll be October 3rd, sound correct? 9:30? have a motion to adjourn to October 3rd?
I will.
Michelle and Francis, thank you. All those in favor, please say aye. Aye. Any opposed? She didn't have her fingers. I was. Thank you, guys. Oh. Okay.
Bye, Sandy.